It's yours truly, Rico Vibes, back with another episode of the Rico Vibes video podcast, and I'm joined today by a special someone. I'm going to have her introduce herself. How are you?
I am well, thank you. I'm well, Rico. My name is Maggie Bonnet, Bonnet, not like Lisa Bonet, a little different.
Like the butter.
It's like the butter, yeah. Or some people will say Bonnet.
But yes,
I don't
true.
fuss over
Depends
it.
on where you're from.
Exactly. So that being said, with the French pronunciation, I'm originally from Haiti. I was born in Haiti, raised in Boston, and I have been living in the Atlanta area for about 16 years now.
Wow. See, most people migrate from Haiti and they go to either New York or Miami. How did you wind up in Boston?
My parents.
Okay.
My mom, actually, she did migrate to New York when she first got here. And then she moved to Boston. Somehow she found her way to Boston.
From one cold to another cold.
Yeah, to another cold. And that's where actually my family's still at.
Okay.
So here, I got here 16 years ago, and it's just me and my children. So the bulk of my family is still in the Boston area.
Okay. What is it that you do?
So Rico, I have what some people will say I am in 3 different fields. So I am working in 3 separate, distinct fields.
Okay.
I am a nurse, I'm a therapist, and I'm a clinical sexologist. So I have a bachelor's in nursing. I went back to school and got a master's in therapy, counseling, psychology, and also a community counseling. And then I went back and got a doctorate in clinical sexology.
Really?
So that means people are like, you have 3 different degrees.
Right.
And that is true.
Was that by design, though?
It was by design to some degree. I can't say it was by design initially. I knew I always wanted to be a therapist, or initially I was going to be a psychologist. But as life would have it, I started off as a nurse.
Gotcha.
I was a teen mom, and so that being said, I had to find a way to make a living much quicker.
Gotcha.
So nursing is a much quicker route, and
Absolutely.
I have absolutely no regret, because it provided me the platform that I needed. So the rest of it is somewhat by design, because I believe in holistic care. So we are human beings who are physiological beings, we are emotional beings, and we are sexual beings. So with that in mind, when I went back and became a therapist, because I always wanted to be able to help people and guide people through their crisis, for lack of a better word, or just support. So I went back and got a degree in community counseling and became a therapist. But there's still that other part that I absolutely love to talk about, and especially growing up, it was so tabooed.
Right.
So one would wonder, why on earth would I even think that way?
Right.
But if you can believe it, I can't remember what year it was, but my oldest daughter, who is now 39, I know, right? Oh my goodness, yes. My oldest daughter was 39. I believe she was in the 3rd grade at the time. And she asked me a question. She came home and asked me a question, a very poignant question. She was like, is it true that a man's penis can be 12 inches long when it's erect? I don't think she used the word erect, but basically, and I was like, how you guys? So they were talking on the bus.
Grade.
She was in the 3rd grade, 3rd or 4th grade, no joke. They were talking about this thing on the bus, and she was curious. She asked her mom, and my back went to the walls. And I was like, I'll get back to you. So I did purchase a book to learn how to talk to her about sex at an age-appropriate level. And I was also really, really, in love. I can't even say any other word. I was so attracted to Dr. Ruth Westheimer.
Yes.
Dr. Ruth.
So you got to be at a certain age to know who Dr. Ruth is.
That is true. That is true. But she is an amazing, phenomenal person.
Yes,
I was very attracted to her openness, and I felt like this is what people should be like.
Gotcha.
This is what we all should be like. I didn't have it. I was attracted to that. And I wanted my children to also have that platform where they can be at ease to talk about sex, to talk about sexuality and whatever else. So I decided later on in life that I wanted to pursue a degree in sex therapy, human sexuality, whatever it was. And by the grace of God, I landed a degree in Florida with the American Academy of Clinical Sexology. And I was able to get my doctorate from there and became also board certified through them.
So, during casual conversation, dinner conversation, whatever, or dating, whatever the case may be. How do you explain that to a guy?
It's hard.
I mean, like, does he try to test you? Like, can we do some theories or whatever? Because guys can be like that.
So people come with the understanding or the belief that because you are a person who talks about, or who's in this situation, it's my profession to talk about sex, that I am an expert in sexual activities.
There's a difference.
There's a huge difference.
Yes. Okay.
I may have the knowledge base, it doesn't mean anything else
Right,
at times.
right.
So it is rather hard at times. And I'll be honest, in the beginning, and being single, I am dating. In the beginning, I wouldn't tell anybody what I do. And when I first meet people, I don't typically say what I do.
Okay.
I am getting a lot more at ease with it right now. But at first, it was really hard because it became the topic of conversation.
Right, I would imagine.
And I don't want that to be what dominates
Gotcha,
our time. So
gotcha.
now I'm a lot more at ease because we talk about a lot of things. And when you talk about sexuality, it's a really broad, really, really broad. And as a clinical sexologist, the focus is not just on the physiological part, it's also on the psychological part of it. So in my studies, we covered a variety of different things. We covered sexual dysfunction. We even covered theology.
Really?
Yes.
What does that have to do with
sex
sex?
and spirituality. So if you, based on your spiritual background or your religious background, it affects the way that you view sex. It affects the way that you think about sex and sexuality.
Got it.
So yeah, it was so funny. I remember telling my mom, I still have to go back and get my theology class. And she's like, you're all over the place. You need to stay focused on what you wanted to do. Because she knows at the time I was in school for sexology. She's like, why are you trying to study theology now? And she didn't comprehend at the time that it's part of it. So that's part of the courses. We cover a gamut of different topics.
Now, as a Caribbean person, us as Caribbean men, we have a problem talking about our feelings, especially our sexual feelings. Do you find that to be an issue with Caribbean clients, maybe?
I find that to be an issue with a lot of clients, but definitely with Caribbean clients. Honestly, I don't get that many people from the islands who come in for therapy.
Really?
My client base is not heavily populated with people from the Caribbean.
Why is that, do you think?
There is a stigma about pursuing help, period, therapy. And as a therapist, I don't just talk about sex. That's my sexuality. That's my specialty.
Right.
But whether you're talking about anxiety, depression, anything else, there's a stigma about seeking help in our community that needs to change. People believe that if I go see a therapist, I'm crazy, I'm out of my mind. In fact, they would be, oh, you're faking it, you just want... I remember back in the days, people would always say, oh, these people, they themselves are crazy.
Right.
And they strongly discourage their within the community seeking any kind of help. You can talk to a doctor, you can talk to a nurse, you can talk to your preacher, your priest, but a therapist, what are they going to do for you?
Yeah.
They just try to get into your headspace.
Correct.
Hence the fact that they used to call us shrinks,
Yeah.
right?
Yep.
So there's always this negative connotation about who therapists are and their purpose, and also to what people have been fed, the message that they got growing up or from others within the community.
Right.
But even now, you think about it, it's just more recently that mental health issues are not being as stigmatized. But they're still being stigmatized in any and every community, right?
Of course.
So more so within the Caribbean community.
During this COVID times, what have you seen in terms of mental health at this time? Have you seen a lot more?
I think the bulk of the mental health issues that we're facing during this time is predominantly depression and anxiety.
Got it.
There's also a lot of grief issues too, because there's a lot of, and the grief is not strictly associated with death, When you think about grief, it's you're grieving a loss. And during this time, we've gone through a lot of losses.
Yes.
Whether it be a loss of a job, a loss of a loved one, and they're not equivalent in any form or fashion, mind you, but it still can create a level of distress in someone. If they lose their job, the children are at home, or they actually have to give up their job in order for the kids to stay home.
Yeah.
Children are going through it as well. So the parents are feeling the brunt of what the kids are going through, the anxiety that the children are going through. So there's a lot of anxiety, and also potentially trauma. But the grief is associated with a variety of different things, not just the love of lost one.
In terms of other areas of your practice, how do you find people take towards you? And a lot of people say, well, therapists have their own therapists.
That's true.
Do you find people are apprehensive to come to you? No.
No. In fact, it's encouraged. It's encouraged as a therapist that you also have your own therapist, if not a therapist, but at least a support network.
Got it.
Because you need to be able to differentiate between your own issues so that you're not projecting them onto your clients.
Got it.
You need to be able to learn to keep that separate, and you are a human being. You are going to also take on other people's issues,
Correct.
other people's griefs, other people's problems, per se. And so you need an outlet to be able to let that out. So yeah, by all means, we all have a support system or support network somewhere, whether you're seeing somebody individually or you have a network of other therapists in your surrounding that you can collaborate with and you can talk to, you can process things with. It's incredibly helpful and it's necessary. In my opinion, it's very necessary.
What's the most common form of therapy do you see mostly these days?
In my practice, I'm in private practice. I still function actively as a nurse, by the way. But in my private practice, I do a lot more couples therapy.
Okay.
I do a lot of couples therapy coming in with any couples issues, marital issues, relationship issues, sexual dysfunctions. The individuals that I see, and surprisingly enough, I do also see a lot of young people, young men who come in with sexual dysfunction issues.
What could be some of the main causes of that?
There are a variety of different causes. First, you almost always want to look at medical issues. So I will do a thorough assessment, inquire about your medical background, any medical problems that you may have, any illnesses. And if those are ruled out, then you start looking at the psychological impact that may be causing you to have any kind of dysfunction or distress. And I say distress because frequently, like there's something that it's not something, there's a term called performance anxiety.
Correct.
And with that, it's a level of distress the person is going through for whatever reason, whatever insecurities they may have. And I don't want to minimize it. There's a lot more to it. But just as a brief example, you want to make sure that you're talking about all sorts of things to see where that is stemming from in order for you to get to the root of it and hopefully help the person get past it.
So relationships is the most common.
I get a lot of couples. Yeah, I get a lot of couples.
Where do you find couples have problems mostly? When they're married, when they're getting ready to get married, or when they've been married for a long time?
All of the above.
Wow.
Because life changes, right? So I have people who come in for premarital counseling.
Right.
So they want to make sure they get it right before they actually say, I do.
Gotcha.
Whether they are living together or they have not been living together, but before they come in, they want to get some counseling. And frequently it's surrounding communication. That's huge for people. Intimacy and communication are the primary. So as you can see, I say all of the above because when you're talking about communication and intimacy, it can have an impact in a couple's relationship at any time. So an older couple, for example, who's been together for 25 years, they've had children, now their kids are out of the house. They are empty nesters. Their whole focus had been on the children, on work, on this, on that. And now they're facing each other, and it's just
For the
the
first
two
time,
of them.
yeah.
And they're really trying to get to know each other, not just as parents, but as individuals. And you can see where if you've never really taken the time during those years with the kids to focus on one another, at that moment, it's a little bit scary.
True.
You're actually finding a whole new person. So as relationships grow and evolve, you as a person also grow and evolve, and you're becoming somebody different each and every time. You're not the same person who had a 3-year-old as you are who had a college student,
Correct.
right?
Correct.
Or an empty nester.
Correct.
So in relationships, you have to have different. You constantly have to revise, is what I'm telling my couples. You constantly have to reevaluate your relationship and have a different conversation and negotiate a new relationship all over at times.
So when you get up on a daily basis, how do you decide which hat you're going to wear today?
I am so glad you say that because the hats intertwine. It's wonderful to be able to have the medical background as a nurse so that I can help in this arena. But when I am working actively as an RN, I do not bring therapy into that realm.
Even if you see that it's probably needed at that
Well,
at some
because
point.
I'm in behavioral health, luckily that helps to some degree. So I can talk about certain things, but I have to stay within my scope of practice
Gotcha.
as a nurse and within the scope that is designed for me in terms of my job description in that facility.
Got it.
So I do know that I need to keep that separate. Now, there are times where because sex and sexuality is a tough subject for a lot of people, I actually have sat on panels for the School of Medicine at Emory. On many occasions, they do a yearly panel for sex education for their first year doctors. I think it's for their first year residents. I can't remember. It's their first year medical students. That's what it is. And it's to help them understand and increase their comfort level to even talk to their patients about sex.
Wow.
So they still exist where physicians don't really talk to you about sex.
Really?
And there are certain sexual issues that people are uncomfortable with. So at times you may find that one of my providers will ask me to talk to somebody about erectile dysfunction as it relates to medication, about kink. That's a huge one for people. And when I say kink, we're talking about people who are into alternative lifestyles, maybe not just that creates kink, but one example, well, this is a grown audience.
Of course.
So one example would be a person who wants a piercing, for example, and wants to know or may have a piercing and want to talk about it and how is it going to affect their sex life or how it's going to affect this. And they want to talk to their physician about this. A physician would be like,
Yeah.
what on earth am I supposed to do
Yeah.
with this?
Yeah.
So hence there may be a time where that's one time or one example of where they might send them to me to talk about.
God. Wow.
Where I can get more in depth about it. Erectile dysfunction. Sometimes it's not just the medication. It may be something else. But when a patient want to go in depth about their erectile dysfunction, and especially if it's a female physician, she may not have the comfort level of talking to them about
Right.
it. And so they might refer. I had one example also has a chaplain who sent a couple to me because they wanted to talk to her about what does she think about bringing someone else in the bedroom.
Wow.
And swinging lifestyles or having a third
And
party.
they brought that to a chaplain?
Well, they were doing couples counseling,
Gotcha.
right?
Wow.
And if they felt that this is something they wanted to explore, the best place to do it or the people to talk about would be your therapist, your counselors, to get some insight and input on what do you think in terms of our dynamic. Is it a good idea? Because there's a lot that goes beyond this, and that's for another time, right?
of course.
But that's not, and you're right, a chaplain would be like,
Yeah,
what am I
yeah,
supposed to do with this? So there are times where they will ask me to please talk to these people so that they can I can ask the questions that they are not comfortable asking in order for them to be able to gain insight and continue on with their therapy.
Has there ever been an instance where you are uncomfortable with a client?
If a client is hitting on me, that might make me uncomfortable at first. But there is such a thing as setting boundaries, and I'm really good at setting boundaries. I raised 4 girls.
Ah. Okay.
So that being said, no, but it does help. It has helped me to be a mom who raised 4 girls and learning how to set boundaries. So I am very quite clear about setting boundaries and asking people to leave if they have to, because I may not be a good fit for you.
Guys.
And I think that's the only time really that I've had any kind of discomfort, and that doesn't really, it has not really happened. Not in my private practice. I've never had anyone disrespect me. In my other setting, I've had people come on to me, but definitely setting boundaries. So that's the only thing that would cause me discomfort at first. And other than that, I really have not had many topics that I'm uncomfortable with, because throughout my schooling and well after, I continue to explore and add to my body of knowledge so that whoever walks into my office, I'm educated about the situation. And if I'm not, I'm open about it. I know a little bit about it and I can explore more with them.